Hey there, future medical professionals. Welcome to another essential tutorial. Today, I'm going to walk you through the essential techniques for collecting throat and nasal swabs for culture specimens. This is a fundamental skill that every healthcare provider should master. This is a crucial skill that you'll need both in the clinic and in the lab. Proper collection techniques ensure the accuracy of your diagnostic tests, which is vital for effective patient care. So let's dive right in. We'll start with throat swab cultures, then move on to nasopharyngeal swabs, and finally, we'll cover nasal specimens for Mycobacterium leprae. First up, throat swab cultures. These are taken under direct vision with good lighting. Proper lighting is essential to ensure you can see the areas you need to swab clearly. Aim for areas of exudation, membrane formation, any inflammation, or if those aren't visible, the tonsillar crypts are your go-to sites. These areas are more likely to yield the pathogens you're looking for. It's super important to get a clear view to ensure accurate samples. Make sure the patient opens their mouth wide and uses a tongue depressor if necessary. Next, let's talk about nasopharyngeal swabs. These are typically better taken by the treating physician or surgeon themselves. The nasopharyngeal area is more challenging to access and requires a bit more skill. For viral agent recovery, you'll collect washings after the patient gargles with nutrient broth. This helps to loosen and collect cells from the nasopharyngeal area. This allows for a more comprehensive sample. Make sure the patient gargles thoroughly to maximize the sample's effectiveness. Now let's move on to nasal specimens for Mycobacterium leprae. Here's how you do it. Have the patient sit with their head tilted backwards but facing the light. This position helps to open up the nasal passages for easier access. Insert and repeatedly rotate the swab into one of the nasal cavities, focusing on the upper part of the nasal septum. This area is rich in cells that can be tested for Mycobacterium leprae. Make 3 evenly spread smears, air dry the slides, wrap them in a paper, and send them to the lab. Proper preparation and packaging are crucial for maintaining the sample's integrity. For nasal washings and nasal blow, make sure the patient is seated comfortably. Place a few drops of sterile saline in their nose. This helps to loosen mucus and cells for collection. After about 3 minutes, ask the patient to blow their nose hard onto a small sheet of plastic or cellophane. This method is effective for collecting a good sample. They can also take the plastic home and repeat this process the following morning before washing. This ensures a fresh sample for testing. Transfer some mucus pieces from the washing to a slide with a clean wooden stick and make a thin smear. This step is crucial for preparing the sample for microscopic examination. Air dry the slide and send it off to the testing area. Proper drying ensures the sample is ready for analysis. And that's it! You've successfully collected throat and nasal swabs. Remember, always follow standard precautions and wear appropriate PPE. This protects both you and your patients from potential infections. These techniques are fundamental for accurate diagnoses and effective treatment plans. Mastering them will make you a more competent and confident healthcare provider. Keep practicing, and you'll master them in no time. Practice makes perfect, and repetition will help you become proficient. Thanks for sticking around, and don't forget to like, subscribe, and hit that notification bell for more medical tutorials. See you next time. Stay safe and keep learning.